Hey everybody, day 13 of 21. Was back in the new ICU last night. It's just chaos there. The floor is not set up for an ICU. We're using bedside monitors, transport monitors, to monitor these very critically ill patients. It's a hot mess. We don't have the medications in our Pyxis, our medication dispenser, um, that we need for the drips and stuff, because this was not an ICU floor. Last night was a difficult shift. See firsthand kind of, I guess, the mentality that this virus has, what it's done to healthcare and how we're having to treat people right now. So the lady that I had mentioned in my post before that came to us from the ER and crashed, well, she had come closer to the end of the shift and she crashed, but she didn't tank, so, or we didn't code her. So we had to change vent settings. We had to add presser to keep her blood pressure up. We had to do some sedation, things like that. When we left our shift that morning, the doctor was supposed to prone her, which means to flip her over onto her stomach. They seem to oxygenate better that way. You see better outcomes the earlier you do this. And paralyze her. So we came back on for our 13th shift, and she had coded at around 5 p.m. I don't think it was a major code. They didn't have the pads hooked up or anything, but I know they did push some epi. And so we walked in, and her oxygen saturation was only 70%. Her blood pressure was in the toilet. So, immediately we're like, she was breathing 40 times a minute. She was not paralyzed. She was not prone. The doctor we had was a fairly new baby doctor. He had on joggers, so he was a youngin', and did not want to listen to any suggestions that myself or one of the other ICU nurses had up there. He did not want to paralyze her. He did not want to turn her prone. He was concerned about her blood pressure. We have medications to get her blood pressure up. But if we don't get her breathing under control, she's not gonna, she's gonna tank again. She can't breathe that fast for that long, and the ventilator just isn't able to do its job. So he did give us one more presser, so she was only on 2. He only had her on 1 sedation medication, and was really just not concerned that we couldn't get her oxygen saturation up. We were able to get her blood pressure up. It would go back down, but then we were able to get it up. Her heart rate stayed in the 140s. We worked on her. We done what we could. We bugged the crap out of this doctor. We need more. We need, do you want us to bag her to try to get her up? We can't just sit here and do nothing. She was only 62. She had hypertension, but really, that was it. This wasn't a woman that was sickly, or this was someone's grandma and mom, and he wouldn't do anything. So for 12 hours, we just had to watch this woman slowly die. She had not passed when we got off shift, but it was imminent. Any minute we were no longer able to get a blood pressure reading at all. We were not able to get an oxygen saturation reading at all. Her heart rate that had been running 130s, 140s all shift was down to the 50s. So we were just waiting, and the family had called twice that shift. So of course they talked to her after they did the code on her, and the family still wanted to continue with everything, do everything. Treatment wise, she was still a full code. And then they called again and spoke to the doctor during our shift. And I don't think he was very clear or forthcoming with them on the situation. I mean, I don't know. I would want to know if it was my mother and I couldn't be there. I would want the truth. I would want you to tell me there's nothing we could do. She's going to die. Something. And then the family called back a little bit later, and you could tell they didn't understand because they asked when she would get a break from the breathing machine. Well, no, there's no breaks. You die, you get a break. So this family is sitting at home, not able to visit, thinking that there's, still hope and a chance, and not that their mom or sister or grandma are actively dying, that we're not. It was just hard. It was hard as a nurse to go against everything that you're trained to do. You go into this to help people, to save people, but really we're glorified order takers. We can only do what we're told, and if you have a doctor that's not willing to do anything, you're just kind of at a loss, and it's just frustrating because I feel like in this instance, had we acted faster, had we proned her, had we paralyzed her to let the ventilator work, I think there was a possibility that she could, that she could have made it. I've seen 3 people extubated in the area that I was before. I was seeing good outcomes. Now everybody's not going to have a good outcome, but you should get a chance. And I just feel like they just gave up before they ever even got started. And it's just really disheartening that that's what this virus has done. It's just hard sometimes. It's hard. You working in the ICU, you see death. It's going to happen. But usually it's after you've worked your ass off trying to save someone that they succumb, not doing a half-ass job and you let them die. So last night was difficult. They brought in an extra refrigerator truck to our facility, so we have 3. They took one off. Yeah, so so that was my shift. That was my 13th shift. So in the meantime, just stay safe, stay at home. People, it's real. It's scary. It's sad.